everyone, Dr. Celestine here, and I want to talk to you today about hormone replacement therapy with menopause. So menopause is diagnosed as having no period for 1 full year, and the average age that happens is usually in your early 50s, but can commonly happen in your 40s as well. However, menopause symptoms can start in the 7 to 10 years before you are actually even diagnosed with menopause. Some of those symptoms include things like hot flashes, sweating at night, memory changes, mood changes, skin, hair, nail changes, weight changes, you name it. Menopause and the hormone shifts with that can affect everything. But I want you to know you don't need to suffer with menopause symptoms. Just because it's a natural process doesn't mean you have to suffer. There are hormonal replacement therapies out there, which we call HRT, and non-hormone replacement options as well that can help you through some of these symptoms. HRT is not as risky as we once thought. What's important with choosing hormone replacement therapy, whether that's estrogen or progesterone based, it needs to be personalized to you, and it needs to be in a process of shared decision making with your doctor to figure out if it's good for you and how it can help you. I do hormone replacement therapy in my practice, and I've helped a countless amount of women, and the option is available to you as well if you're going through menopause. You don't need to suffer, but talk to your doctor about it.